Do you use electric or manual toothbrush? If you use electric toothbrush, raise your hand.
I do both.
Yeah, I
Oh,
use both electric
Yeah.
mostly, but I do use
Yeah.
oh, that's very interesting. Could you
yeah.
maybe elaborate a little more, like why you chose to use one or the other, and why you use both, maybe?
I mean, like in the morning, I use the electric toothbrush, but at the office, I usually use a manual toothbrush during my lunch
Mhm.
hour. Also, like when I'm traveling, I'm not really good at carrying everything, so I just bring a manual toothbrush with me. I think it's more important about like proper brushing technique because even when you're using electric toothbrush, if you're just on one surface for a long time, it's actually not going to make a big difference. It's more about making sure you brush each surface,
Yeah.
whether it's a manual or electric toothbrush, and it's not even just about the timing, but it's more about like making sure you clean each surface. So it's actually a very intentional, you know, motion that you
Definitely.
have to go through.
Similar to Dr. Kim. So I left an electric toothbrush when I was traveling for a wedding about 3 years ago, and I never got over that loss. So now when I travel, I just take a manual. I'd much rather lose that. And at the office, I use a manual as well. But I do find that, you know, right when I wake up and right before bed, I like to use the electric. But any other time, if I do happen to brush, I tend to use a manual. Or if there's a spot that I really feel like I need to get to, then you put the manual right where you want it. But when patients ask, often, and usually I just say whichever one you're going to use and use correctly, more so than a specific brand or type. But the technique is everything. The routine and the consistency is everything.
Mm.
Yeah, some patients don't have the manual dexterity to utilize a manual toothbrush. So
Yeah.
Electric toothbrush is just going to be hands down better for them.
Precisely.
I think that's actually really a good segue to the next question. Who do you recommend to use electric toothbrush? And I think that's going to explain the kind of pros of electric toothbrush, maybe. Maybe Dr. Prieto can answer us.
Yeah, it kind of just boils down to there's certain patients that in examining them and talking to them and seeing them for appointments, you'll be able to kind of gauge their ability to to be able to take care of their teeth, whether that's brushing their teeth or if they have some sort of like appliance, things like that. Like there's certain things that patients, whether it's just due to medical conditions or age, things like that, where they just aren't, it's just not capable for them to do that. And so I think that's when electric toothbrushes and definitely trumps just a manual toothbrush and other aids as well for them, so they can help kind of maintain their oral health.
Mm-hmm.
And a manual toothbrush used the wrong way can definitely do a lot more damage. Most of the electric toothbrushes now give you feedback. If you press too hard, it'll buzz and let you know. Some of them will just stop completely. So, there's patients with whether it's gum recession or abrasion that you can tie to, just scrubbing your teeth, thinking that that's the way to get a tooth clean. I do think, again, it all boils down to technique, but the electric toothbrush does kind of do some of that for them.
What is good toothbrush?
Soft is key, I would say.
Hmm.
For some reason, you can buy a medium or a hard bristle toothbrush. I don't see it as much now as when I was younger. Like as a kid, I remember, hard, and we think before we're dentally educated that if you want something to be clean, you scrub it.
Yeah.
Right. So it's just a bad combination. But there's soft and there's extra soft. I just usually recommend using the extra soft toothbrush. Again, because the angle that you brush at, 45 degrees to the gum, that's enough to get into the space between the teeth, as well as the area where the gum and the teeth get together. And if you're using it correctly, that's going to get everything out, especially in combination with flossing and an oral rinse. Like you should never have to physically, plug something out of your mouth with your toothbrush.
And also, I always tell patients, like, don't use a toothbrush that's too large also, because you really want easy access to, areas that are really hard to reach, like the back of the molars, your teeth in the back, like the sides. And those are usually the spots that a lot of patients can miss. So I think, which is why, electric toothbrushes are manufactured a little bit smaller, and you can really reach those areas.
Why do you think there's so much variable for the manual toothbrush? I find it so interesting. There's all kinds of like rubber plus nylon and hard and soft and large and small. If there's really one kind of like good toothbrush, which is soft and not so big.
I think they're all just trying to have variations of different things that can try to get into some of those harder to clean areas. Because again, with manual, it comes down to technique. So if you're not being conscious of that, then people might be missing certain things. So I think maybe those companies are just kind of adding different aspects to the actual toothbrush head to try to be able to mitigate that a little bit.
I think a soft bristle brush used correctly does all the things that we need to have done. There's when I simplify it, I tell patients there's really two types of cavities. There's brushing cavities and there's flossing cavities. It either happens where floss should be between the teeth, or it happens on the teeth where the brush should go. And I think that as long as you keep that in mind as you address each tooth, it's hard to go wrong. Gum stimulators, I think, are great. Brushing your tongue is great. There's a lot of adjuncts that we can use, but when it really boils down to it, just good brushing and religious flossing, and then come see your dentist, as necessary, a couple times a year.
Great. Maybe we can talk about what is the good brushing technique a little bit, just so we can educate the OJOOK customers how they should use our toothbrush, whether that's manual or electric.
So one of them is, as Dr. Kim said, get each surface. So that's top of the tooth, tongue side, cheek side, and with the proper angulation, 45 degrees, trying to get into all the in-between spots between those teeth. So that's one.
Yeah. And then along with that, we say small circular motions, and that really makes sure that you hit every surface. The back and forth, in commercials and stuff, that's what we see, but the small circles are what really address each area of the tooth and make sure you don't miss any spots. If my fist is the tooth and this is the gum, we want the bristles of the brush to point. So this is 90 degrees. We want it 45 degrees, so that actually gets into that. We call it the sulcus, but it's just that pocket where and if you've ever had something get stuck before, that's really where we're trying to get into.
I think in my Korean dentist, she told me I need to brush like kind of brush it out, so it doesn't like go back and like get stuck. The plate would stuck into my gum or something. Does it make sense?
I guess the insides, when people brush, they brush like the sides of the molars, and then oftentimes I see like they miss, for your anterior tooth, your front teeth, they forget to brush the insides. So you want to use like those motions where you're brushing outwards, like to the edge of the tooth from the inside, starting from the gums, and just brushing it out so you can remove any food particles.
Okay.
Yeah.
How often should we change our toothbrush head, whether it's manual or electric?
Yeah. 3 months.
3 months. That's actually quite long.
Yeah, and they say if you've been sick, especially now with COVID, but if you've had a cold or a flu or something like that, then you should probably change it afterwards also, just so you're not recycling any bacteria or anything harmful.
Yeah.
I put it in the boiling water. I'm a little germophobic. And what's the sign that you notice the wear and tear, and because some people probably brush much harder?
Yeah,
like the bristles, fraying.
Yeah,
I think electric, because they're a little shorter, they can fray a little bit faster, so they might need to be changed a little bit more so than a manual. But like I said, it kind of just depends patient to patient.
Yeah. But what's your take on the plastics that's being used in current day oral care?
Being like a dentist, I always wonder, can we make things more sustainable? Because toothbrushes, toothpaste, all these things, we're using it. It's not something we can just use for a short time. We're not going to use it. We're using it daily. So if we're constantly replacing them, I think we should use materials that are sustainable for the environment. And I think that's what everyone's focusing on these days, right?
Absolutely.
Yep.
Yeah. Okay. And about the time, people say 2 minutes. Why is it 2 minutes? Should this be less or more? How do you, what are the tricks to measure 2 minutes when you're using manual toothbrush?
I've heard them say sing the alphabet twice. I've never timed it, but that's one way to make sure. I think it's just to not rush and to make sure you touch every surface. Yeah.
So yeah, just put on whatever music you like and
Mhm.
hang out for 2 minutes. Rush.
Yeah.
And
I
like
love
Dr. Kim was saying,
yeah.
oh, sorry.
Dr. Prieto really likes music. I love this group. All to relate things about like length of the music, listen to music in the morning. Well, thank you so much.